Kaylee. I'll be your student nurse today. I'm going to be giving you a medication injection. I'm going to do hand hygiene quick. Can I have you verify your name and date of birth for me, please?
Yes, Henry Keller, 2/25/1973.
Okay, I'm just going to scan you in here. Henry Keller, yep. And then can you tell me your allergies?
Penicillin.
Yep, and your birthday looks correct too. Okay. So now I'm just going to go to the MAR here and see what you have for medication. So it looks like you have cimetidine, 150 milligrams per 1 ml, and it's 450 milligrams that we'll be giving, so that'll be 3 milliliters. Okay, so I'm just gonna grab your medication here and do, oop, not that one, wrong person, do Henry's. Okay. So we have cimetidine, 150 milligrams per 1 ml, and it's 450 milligrams, so that will be 3 mils. Okay, so now I'm just going to assess the patient's body build, muscle mass, and weight. So he looks like a healthy adult male. So now to go over sites, if I were to do the deltoid, I would go 3 to 4 fingers from the acromial process and then give right there. And then that can hold up to 2 mils of medication, and I would use a 1 to 1.5 inch needle. And then the vastus lateralis, I would go from the greater trochanter or a little below, or the groin, and then just above the knee, because we're breaking it into thirds. So then I would do the middle third, and that can hold up to 3 mils of medication. So I would use a 1 to 1.5 inch needle as well. And then now I'm just gonna turn patient over. And then in the ventrogluteal, I would find the greater trochanter and then fingers up towards the iliac crest and then thumb towards the groin and then sweep these fingers back and then right in there. And that can hold up to 3 mils of medication, and I would use a 1.5 inch needle for that. And then since the patient is going to be getting it in that location, I'm just going to leave them like this. So now I am just going to do my second check here. Cimetidine, 150 milligrams per 1 ml. Okay, looks good. So now I'm going to do hand hygiene. Come over here and get everything ready. So I'm going to need some alcohol swabs, gauze. And then I would be using an 18 gauge needle to drop the medication, but we do not have any available, but that's what I would use. And then to actually give the medication, I would be using a 22 gauge 1.5 inch needle, and then my syringe will be a 3 milliliter syringe because I'm giving 3 milliliters of medication. So now I'm just going to clean the top. And then during that first or second check, I'm just going to note the medication expiration, the patient's name, the route, dose, and time, just to make sure everything's okay. And then I'm going to clean the top of this vial for 15 seconds. It's been 15 seconds. I'm just going to let that dry. And then now I'm going to open this and then use my 18 gauge needle to drop the medication. Just making sure everything stays sterile. Shimmy off the top and then pull up 3 mils of air. Inject that air into the medication vial. And then invert and draw up the 3 mils here. go just some beyond to make sure I get the correct amount. I'm gonna put my safety cap on, making sure not to touch the top of the needle on the table. Okay, and then just gonna get the bubbles out and then make sure I have 3 mils here. Okay, so 3 mils. Okay, and then now I'm gonna take this off, and since I can't inject in the trainer, I'm just gonna inject this back in. Activate safety, take the top off, and then open up my 22 gauge 1.5 inch needle, making sure to keep that sterile as well. And I'm just gonna pull up the medication amount, which is 3 mils. And then I'm gonna do my third check and scan in. So I'm going to scan this in. Okay, so we have cimetidine, 150 per 1 mil, and it's 450 milligrams, so that's 3 mils. So everything looks good there. Given, dosage given 3, location given, ventral gluteal. Okay, so everything looks good. Now I'm gonna come over here and just do hand hygiene again and put my gloves on. So now I've done my 3 checks and the patient is ready to get the medication. I'm just gonna shimmy the top off here so it's a little bit easier. Okay, grab my alcohol swab. Find that greater trochanter, fingers up towards the iliac crest, thumb towards the groin. Sweep my fingers, so it's gonna be right in there. So I'm gonna wipe from inner to outer. And then mark my site about 1 inch from where I'm gonna be giving it. And then now I'm ready to give it. So I'm gonna just tell the patient that you might feel a sting. So now I'm going to Z-track, so just pull the skin, holding that Z-track, putting the needle in at 90 degrees, stabilizing while keeping my Z-track, aspirating for blood, no blood. So now I'm going to inject at 1 mil every 10 seconds. Okay, and release it, activate my safety, dispose of that, use gauze to apply pressure, and then if he's bleeding, I will put a Band-Aid on him, but he's not bleeding, so everything looks good. So now I'm going to get rid of my gloves, get rid of all of my supplies, do hand hygiene, assist the patient to a comfortable position, and then document the response. I would stay with them for a while to make sure there's no reaction, and then I would document the response, the time, route, site, date, and location, and just make sure everything is okay, and then come back to assess the client again.